Maintenance in invisible orthodontics is essential to ensure therapeutic effectiveness, prevent deviations from the digital plan, and preserve the integrity of dental and periodontal tissues. A well-structured review protocol allows complications to be detected early and plan movements to be adjusted according to the patient's clinical response. During checkups, the fit of the aligner, the progress of tooth movement, the integrity of the attachments, and patient cooperation are evaluated. Visits are usually scheduled every 4 to 6 weeks, although in some cases they may be spaced out if compliance is adequate and treatment is progressing without incident. In this sense, the protocol is indicated in active treatments with aligners in progress, especially when prolonged sequential movements are planned or in patients at risk of low adherence. In fact, it is not indicated to omit checkups in patients with a history of relapse, poor hygiene, gingival alterations, or movements that are difficult to execute. It is also not recommended to space out checkups excessively during critical phases of treatment. Finally, a systematic checkup protocol improves the stability of results, minimizes cumulative errors, and optimizes the therapeutic experience. In turn, clinical follow-up allows deviations to be corrected in a timely manner, maintaining the safety, efficiency, and predictability of invisible orthodontic treatment.